Hello everyone, it's me Sanjita Pandit. Welcome back to channel Medical with Sanju. Nepal Nursing Council based model exam. Set-12. Question number 1. In following, which statement is not true regarding amniotic fluid? Option A. At term, it measures about 600 to 800 ml. Option B. It is alkaline in nature. Option C. Specific gravity is about 1.010. And option D. Near term, its color is golden. Option A, B and C are true regarding amniotic fluid, but option C is not true regarding amniotic fluid. Physical characteristics of amniotic fluid भन्दाखेरि के हुन्छ यो क्लियर एन्ड अल्कलाइन नेचरको हुन्छ हैन एभ्री 3 आवर्स मा रिप्लेसमेन्ट हुन्छ स्पेसिफिक ग्राभिटी 1.010 हुन्छ इयरली प्रेग्नेन्सी मा यसको कलर क्लियर हुन्छ हैन एन्ड मिड प्रेग्नेन्सी मा येलोइश कलर हुन्छ बिकज अफ प्रेजेन्स अफ बाइल पिगमेन्ट एन्ड लेट प्रेग्नेन्सी मा यसको कलर चाहिँ कलरलेस हुन्छ ड्यू टु प्रेजेन्स अफ भर्निक्स ग्यासेस एट टर्म इट इज हाइपोटोनिक टु मेटर्नल सेरम व्हिच सजेस्ट फिटल म्याच्युरिटी नर्मल भोल्युमको कुरा गर्दाखेरि 12 वीक्स मा 50 ml हुन्छ 20 वीक्स मा 400 ml 36 to 38 वीक्स मा 800 ml 800 ml to 1 liter सम्म हुन्छ यो भनेको पिक हो पिक यति सम्म हुन्छ त्यसपछि एट टर्म प्रेग्नेन्सी मा 600 to 800 हुन्छ र पोस्ट टर्म मा यसको चाहिँ भोल्युम डिक्रिज हुँदै जान्छ र 200 ml हुन्छ डिमिस्ड हुँदै जान्छ कलर को कुरा गर्दाखेरि के हुन्छ ग्रीन कलर इंडिकेट फिटल डिस्ट्रेस गोल्डन कलर इंडिकेट आरएच इनकम्पैबिलिटी greenish yellow color indicate post maturity dark color indicate hemorrhage concealed hemorrhage and dark brown color indicate IUD intrauterine death. Question number 2. The lochia on the first few days after delivery is characterized as option A pinkish with some blood clots, option B whitish with some mucus, option C reddish with some mucus and option D serum with some brown tinged mucus. Option A is the right answer reddish with some mucus. First few days भनेको लोकिया रुब्राको कुरा यहाँ भनेको छ लोकिया भनेको डिस्चार्ज आफ्टर डेलिभरी र लोकिया तीन किसिमको हुन्छ लोकिया रुब्रा लोकिया सेरोसा एन्ड लोकिया अल्बा लोकिया रुब्रा 1 to 4 days सम्म हुन्छ यो भनेको डार्क रेड कलर हुन्छ बिकज अफ इट कन्टेन्स ब्लड क्लट्स एन्ड लोकिया सेरोसा 5 to 9 days सम्म हुन्छ ब्राउनिश कलर को हुन्छ बिकज इट कन्टेन्स इरिथ्रोसाइट्स ल्युकोसाइट सर्भाइकल म्युकस माइक्रो अर्गानिज्म एन्ड लोकिया अल्बा भनेको चाहिँ यो 9 to 12 days सम्म चाहिँ हुन्छ र यो भनेको चाहिँ व्हाइटिश येलो कलर को हुन्छ बिकज अफ इट कन्टेन्स डेसिडुअल सेल्स म्युकस व्हाइट ब्लड सेल एन्ड इपिथेलियन सेल्स. क्वेश्चन नंबर 3. Postpartum period, the fundus of the uterus is expected to go down normally postpartally about centimeter per day. Option A 1 centimeter, option B 2 centimeter, option C 2.5 centimeter and option D 3 centimeter. Immediately after birth, symphysis pubis र umbilicus को बीचमा हुन्छ fundus 12 to 24 hours सम्म at अम्बिलिकस मा हुन्छ देन 1 सेन्टिमिटर को दरले तलतिर आउने थाल्छ र एट 10 days मा नन प्रेग्नेन्ट स्टेज मा आउँछ फन्डस. क्वेश्चन नंबर 4. आफ्टर RH नेगेटिभ मदर हैज डेलिभर्ड RH पोजिटिभ बेबी द मदर इज गिवन RH ग्राम दिस इज डन इन अर्डर टू ऑप्शन A प्रिभेन्ट द रिकरेन्स अफ RH पोजिटिभ बेबी इन अ फ्यूचर प्रेग्नेन्सी. Option B prevent the mother from producing antibodies against the RH positive antigen that she may have gotten when she delivered to her RH positive baby. Option C ensure that future pregnancy will not lead to maternal illness and option D to prevent the newborn from having problem of incompatibility when it breastfeeds. Option B is the right answer. Prevent the mother from producing antibodies against the RH positive antigen that she may have gotten when she delivered to her Rh positive baby. Question number 5. To enhance milk production, a lactating mother must do the following interventions except option A. Increase fluid intake. Option B. Eat food that increase lactation, which are called galactagogues. Option C. Exercise adequately like aerobics. And option D. Have adequate nutrition and rest. The right answer is option C. Exercise adequately like aerobics. यो बाट चाहिँ मिल्क प्रोडक्सन चाहिँ हुँदैन यो एक्सरसाइजबाट यो एक्सरसाइजले के गर्छ डिजाइन टु इन्क्रिज द कार्डियोभास्कुलर इफिसिएन्सी क्वेशन नंबर 6 The nursing interventions to relieve pain in breast engorgement while the mother continue to breastfeed is option A. Apply cold compressions on the engorged breast. Option B. Apply warm compressions on the engorged breast. Option C. Massage the breast. And option D. Apply analgesic ointment. Option B is right answer. Apply warm compressions on the engorged breast. Question number 7. Greenish yellow color of amniotic fluid indicates option A. Fetal distress. Option B. Rh incompatibility. Option C. Post maturity. And option D. IUD. Question number 1 मा describe गरेको abnormal color of amniotic fluid को बारेमा है option C is the right answer. Post maturity. Greenish yellow indicate post maturity. Greenish color indicate fetal distress. Golden color indicate Rh incompatibility. Dark color indicate concealed hemorrhage. Dark brown color indicate IUD, intrauterine death. Question number 8. To ensure adequate lactations, the nurse should teach the mother to option A. Breastfeed the baby on self-demand day and night. Option B. Feed primarily during the day and allow the baby to sleep through the night. Option C. Feed the baby every 3 to 4 hours following a strict schedule. Option D. Breastfeed when the breast is engorged to ensure adequate supply. Option A. Breastfeed the baby on self-demand day and night. Option A is the right answer. Question number 9. An appropriate nursing intervention when caring for a postpartum mother with thrombophlebitis is mother to ambulate to relieve the pain in the leg. Option B. Instruct the mother to apply elastic bandage from the foot to going towards the knee to prevent venous return flow. Option C. Apply warm compressions on the affected leg to relieve the pain. And option D. Elevate the affected leg and keep the patient on bed rest. Option D is the right answer. Affected leg लाई चाहिँ elevate गरेर राख्नु पर्छ. Question number 10. Which of the following hormone is not produced by placenta? Option A. Testosterone. Option B. Estrogen. Option C. Progesterone. And option D. HCG. Option A is the right answer. Testosterone. Question number 11. According to Revin's theory of a maternal role adaptation, the mother will go through 3 stages during the postpartum period. These stages are option A. Going through adjustment period, adaptation period. Option B. Taking in, taking hold and letting go. Option C. Attachment phase, adjustment phase, adaptation phase. Option D. Taking hold, letting go and attachment phase. Option B is the right answer. Taking in, taking hold and letting go. Question number 12. The neonate of a mother with diabetes mellitus is prone to developing hypoglycemia because option A. The pancreas is immature and unable to secrete the needed insulin. Option B. There is rapid diminution of glucose levels in the baby's circulating blood and his pancreas is normally secreting insulin. Option C. The baby is reacting to the insulin given to the mother. Option D. His kidneys are immature leading to a high tolerance for glucose. Option B is the right answer. There is a rapid diminution of glucose levels in the baby's circulating blood and his pancreas is normally secreting insulin. Question number 13. Which of the following is an abnormal vital sign in postpartum? Option A. Pulse rate between 50 to 60 per minute. Option B. Blood pressure diastolic increase from 80 to 95 mmHg. Option C. Systolic blood pressure 100 to 112 mmHg. And option D. Respiratory rate 16 to 20 per minute. Option B is the abnormal diastolic pressure increase 80 to 95 mmHg. Question number 14. Organogenesis occurs in option A. First trimester, option B. Second trimester, option C. Third trimester, and option D. all of the above. First trimester organogenesis हुन्छ. Question number 15. A nurse is monitoring the amount of lochia drainage in a client who is 2 hours postpartum and notes that the client has a saturated perineal pad in 1 hour. The nurse reports the amount of lochia flow as option A. excessive, option B. heavy, option C. light, and option D. scanty. Option B is the right answer. It is a heavy. Question number 16. In a woman who is not breastfeeding, menstruations usually occur after how many weeks? Option A. 2 to 4 weeks, option B. 6 to 8 weeks, option C. 6 months, and option D. 12 months. जुन मदरले ब्रेस्ट फिडिङ गराउँदैन उहाँहरूको 6 to 8 weeks मा नै पिरियड चाहिँ स्टार्ट हुन्छ. Question number 17. The following are nursing measures to stimulate lactation except option A. frequent regular breastfeeding, option B. breast massage, option C. breast pumping, and option D. application of cold compression on the breast. Option D is the right answer. Application of cold compressions on the breast यसले चाहिँ lactationलाई stimulate गर्दैन, suppress गर्छ. Application of hot compressions on the breast ले चाहिँ stimulate गर्छ lactationलाई. Question number 18. Organogenesis takes place in which stage of development? Option A. germinal, option B. zygotic, option C. embryonic, and option D. fetal. Embryonic stage मा हुन्छ. Option C the right answer. Question number 19. The following are interventions to make the fundus contract postpartally except option A. make the baby suck the breast regularly, option B. apply ice cap on fundus, option C. massage the fundus vigorously for 15 minutes until contracted, and option D. give oxytocin as ordered. Option C is the right answer. Massage the fundus vigorously for 15 minutes until contracted. Question number 20. What is the correct about test tube baby? Option C. fertilization inside female genital tract and grow in test tube. Option B. rearing up prematurely born in incubator. Option C. fertilization outside and gestation inside womb of mother. And option D. both fertilization and development are effected outside the genital tract. Option C is the right answer. Fertilization outside and gestation inside womb of mother. यसमा के हुन्छ? A baby born to a mother whose womb was removed, fertilized outside her baby, जसलाई in vitro fertilizations पनि भन्छ IVF, and then implantation in her uterus called test tube baby. Question number 21. Fetus swallow some amount of liquid every day about option A. 300 ml, option B. 400 to 700 ml, option C. 200 ml, and option D. none of the above. The right answer is option D. none of the above. After 16 weeks 200 to 500 ml liquid size swallow गर्छ fetusले. Question number 22. The neonatal circulation differed from the fetal circulation because option A. the fetal lungs are non-functioning as an organ and most of the blood in the fetal circulation is mixed blood. Option B. the blood at the left atrium of the fetus heart is shunted to the right atrium to facilitate its passage to the lungs. Option C. the blood in the left side of the fetal heart contains oxygenated blood while the blood in the right side contains unoxygenated blood. And option D. none of the above. Option A is the right answer. Question number 23. The normal respiration of a newborn immediately after birth is characterized as option A. Shallow and irregular with short periods of apnea lasting not longer than 15 seconds, 30 to 60 breaths per minute. Option B. 20 to 40 breaths per minute. Abdominal breathing with active use of a intercostal muscle. Option C. 30 to 60 breaths per minute with apnea lasting more than 15 seconds abdominal breathing. Option D. 30 to 50 breaths per minute active use of abdominal and intercostal muscles. The right answer is option A. Question number 24. The interior fontanelle is characterized as option A. 3 to 4 cm anterior posterior diameter and 2 to 3 cm transverse diameter diamond shape. Option B. 2 to 3 cm anterior posterior diameter and 3 to 4 cm transverse diameters and diamond shape. Option C. 2 to 3 cm in both anterior posteriors and transverse diameter and diamond shape. Option D. None of the above. Option A is the right answer. 3 to 4 cm anterior posterior हुन्छ, 2 to 3 cm transverse हुन्छ and diamond shape को हुन्छ. Question number 25. The ideal site for vitamin K injections in the newborn is option A. Right upper arm. Option B. Left upper arm. Option C. Either right or left buttocks and option D. middle third of thigh. Option D is the right answer. Middle third of thigh मा दिन्छ, यहाँ D हुन्छ. Question number 26. At what Apgar score at 5 minutes after birth should resuscitation is initiated? Option A 1 to 3 Apgar score. Option B 7 to 8. Option C 9 to 10 and option D 6 to 7. Normal Apgar score 7 to 10 हुन्छ. 5 to 6 मा आएको छ भने mid birth asphyxia. 3 to 4 छ भने त्यो चाहिँ moderate birth asphyxia हुन्छ and 0 to 2 छ भने severe birth asphyxia हुन्छ. 1 to 3 मा आएको छ भने resuscitation चाहिँ दिनुपर्छ. Option A is the right answer. Question number 27. Right after birth, when the skin of the baby trunk is pinkish, but the sole of the feet and the palm of the hand are bluish, this is called option A syndactyly, option B acrocyanosis, option C peripheral cyanosis, option D cephalocaudal cyanosis. The right answer is option B acrocyanosis. Cyanosis found in the extremities, particularly the palm of the hand and sole of the feet. It is normal in babies as long as no cyanosis is present in the central part of the body. Question number 28. The minimum birth weight for full-term babies to be considered normal is option A 2000 grams, option B 1500 grams, option C 2500 grams, option D 3000 grams. Option C is the right answer, 2500 grams. Question number 29. Development in children refers to one of the following. Option A increase in size of body parts, option B increase in intercellular substance, option C qualitative change and progressive increase in a skill and capacity to function, and option D quantitative change in a body. Option C is the right answer. Qualitative change and progressive increase in skill and capacity to function. Growth and development दुई बेग्ला बेग्लै शब्द हो. Development भनेको qualitative changes in the body functions like progressive improvement in the skill and capacity to the function. अर्को growth भनेको quantitative change like increase in size and body mass. Question number 30. Tears start to appear at which age? Option A at birth, option B 1 week, option C 2 months and option D 1 year. Option C is the right answer. 2 month पछि मात्र बच्चामा टियर हुन्छ. सुरुमा 2 month सम्म चाहिँ रुँदाखेरि बच्चामा आवाज मात्र आउँछ, आँसु चाहिँ आएको हुँदैन. बट 2 month देखि चाहिँ आँसु आउँछ. Question number 31. What is the ratio between upper and lower segment of the body at birth as measured from symphysis pubis? Option A 1.7 is to 1.0. Option B 1.3 is to 1. Option C 1 is to 1. And option D 1 is to 2.3. Option A is the right answer. सिम्फेसिस पिबिसलाई सेन्टर मानेर त्यहाँबाट चाहिँ रेसियो निकाल्छ अपर पार्ट र लोअर पार्टको एट बर्थ 1.7:1 को रेसियोमा हुन्छ 3 इयर्समा 1.3:1 को रेसियोमा एन्ड 10 इयर्समा 1:1 को रेसियोमा आउँछ क्वेशन नम्बर 32 व्हाट इज द ट्राइमेस्टर वाइज वेट गेन इन प्रेग्नेन्सी ऑप्शन ए 1 kg 5 kg 2 kg ऑप्शन बी 5 kg 2 kg 5 kg ऑप्शन सी 1 kg 5 kg 5 kg एंड ऑप्शन डी 5 kg 5 kg 5 kg ऑप्शन सी द राइट आंसर फर्स्ट ट्राइमेस्टर्स में 1 kg सेकेंड ट्राइमेस्टर्स में 5 kg एंड थर्ड ट्राइमेस्टर में 5 kg क्वेश्चन नंबर 33 lactation amenorrhea method CAM can be an effective method of a natural birth control if option A the mother breastfeeder mainly at night time when ovulation could possibly occur. Option B the mother breastfeeds exclusively and regularly during the first 6 months without giving supplemental feeding. Option C the mother use mixed feeding faithfully. Option D the mother breastfeeds regularly until 1 year with no supplemental feeding. Option B is the right answer. The mother breastfeeds exclusively and regularly during the first 6 months without giving supplemental feeding. Question number 34. The amount of water retained during pregnancy at term is estimated to be option A 5 liter, option B 5.5 liter, option C 6 liter, option D 6.5 liter. Option D is the right answer 6.5 liter. Question number 35. Oral contraceptive pills are of different types. Which type is the most appropriate for mothers who are breastfeeding? Option A estrogen only, option B progesterone only, option C mixed type of estrogen and progesterone, and option D 21-day pills mixed type. Option B is the right answer progesterone only. Question number 36. The natural family planning method called standard day SDM is the latest type and easy to use method. However, it is a method applicable only to women with a regular menstrual cycle between ... days. Option A 21 to 26 days. Option B 26 to 32 days. Option C 28 to 30 days. Option D 24 to 36 days. यो साइकल चाहिँ SDM मेथडमा रेगुलर पिरियड्स हुन्छ र साइकल भनेको चाहिँ नेभर सर्टर देन 26 days एन्ड नेभर लङ्गर देन 32 days. Option B the right answer. Question number 37. On which of the following area a nurse would expect closma? Option A breast, areola, nipple. Option B chest, neck, arm, leg. Option C abdomen, breast, thigh. And option D cheeks, forehead and nose. Option D the right answer. Cheeks ma, forehead and nose ma चाहिँ close ma देखा पर्छ during the pregnancy. Question number 38. The following methods of artificial birth control works as a barrier device except option A condom, option B cervical cap, option C cervical diaphragm, and option D intrauterine device IUD. Option D IUD. IUD भनेको hormonal method हो. अरू like condom, cervical cap, cervical diaphragm are barrier device. Question number 39. Which of the following is a true statement about normal ovulation? Option A it occurs on the 14 days of every cycle. Option B it may occur between 14 to 16 days before next menstruation. Option C every menstruation period is always preceded by ovulation. And option D the most fertile period of a woman is 2 days after ovulation. Option B is the right answer. It may occur between 14 to 16 days before next menstruation. Question number 40. If a couple would like to enhance their fertility, the following means can be done. Option A Monitor the basal body temperature of a woman every day to determine peak period of fertility. Option B. Have adequate rest and nutrition. Option C. Have sexual contact only during the dry periods of women. And option D. All of the above. All of the above is the right answer. Option D. Question number 41. In Symptothermal Method, the parameters being monitored to determine if the woman is fertile or infertile are: Option A. Temperature, cervical mucus, cervical consistency. Option B. Release of ovum, temperature and vagina. Option C. Temperature and wetness. Option D. Temperature, endometrial secretion, mucus. Option A is the right answer. Temperature, cervical mucus, cervical consistency. Question number 42. Which should avoid during pregnancy? Option A. Smoking, alcohol, tobacco chewing. D. All of the above. During the pregnancy, smoking, alcohol, tobacco सबै चाहिँ avoid गर्नुपर्छ. Question number 43. To determine if the cause of infertility is a blockage of the fallopian tube, the test to be done is: Option A. Hunner's test. Option B. Rubin's test. Option C. Postcoital test. And option D. None of the above. Fallopian tube मा ब्लकेज आएको छ भने त्यो चाहिँ आइडेन्टिफाई गर्नका लागि रुबिन्स टेस्ट गर्छ प्याटेन्सिया fallopian tube हेर्नका लागि. Question number 44. Infertility can be attributed to male cause such as the following except: Option A. Cryptorchidis. Option B. Orchitis. Option C. Sperm count of about 20 million per milliliter. And option D. Premature ejaculation. Option C the right answer. Sperm count of about 20 million per milliliters. Normal 20 million to more than 200 million हुन्छ नर्मल. यो भनेको नर्मलमा आउँछ. लेस देन 20 इफ हुन्थ्यो भने त्यो चाहिँ इन्फर्टिलिटी हुन्थ्यो. बट यहाँ एक्सेप्ट सोधेको छ. त्यही भएर आन्सर सी द राइट आन्सर. Question number 45. Spleen Enlargement is an indicator of ovulation which is categorized as: Option A. Thin watery mucus which can be stretched into a long strand about 10 cm. Option B. Thick mucus that is detached from the cervix during ovulation. Option C. Thin mucus that is yellowish in color with fishy odor. Option D. Thick mucous vaginal discharge influenced by high level of estrogen. Option A is the right answer. Thin watery mucus which can be stretched into a long stand about 10 cm. You can see in this picture यस्तो किसिमको चाहिँ योमा mucus चाहिँ भएको हुन्छ cervical mucus. Question number 46. Vasectomy is a procedure done on a male for fertilization. The organ involved in this procedure is: Option A. Prostate gland. Option B. Seminal vesicle. Option C. Testis. And option D. Vas deferens. Vasectomy, vas deferens को चाहिँ यो सर्जरी हो. Option D the right answer. Question number 47. Breast self examination is best done by the woman on herself every month during: Option A. The middle of her cycle to ensure that she is ovulating. Option B. During the menstruation period. Option C. Right after the menstruation period so that the breast is not being affected by the increase in the hormone, particularly estrogen. And option D. Just before the menstruation period to determine if ovulation has occurred. Option C the right answer. Question number 48. A woman is considered to be menopause if she has experienced cessations of her menstruation for a period of: Option A. 6 months. Option B. 12 months. Option C. 18 months. Option D. 24 months. Option B. 12 months. 12 months सम्म चाहिँ menstruation period आएन भने त्यो post menopause मा जान्छ. Question number 14 line. Linea Nigra in pregnancy is due to the stimulation of this hormone: Option A. HCG. Option B. Progesterone. Option C. Human placental lactogen. And option D. Melanocyte stimulating hormone. During the pregnancy को बेलामा skin changes हुन्छ जुन melanocyte stimulating hormone लाई गराउँछ. Question number 50. In assisted reproductive technology (ART), there is a need to stimulate the ovaries to produce more than one mature ovum. The drug commonly used for this procedure is option A estrogen, option B clomiphene, option C Provera, and option D bromocriptine. Option B is the right answer. Question number 51. The part of the ear that distinguishes different pitch of sound is option A organ of Corti, option B vestibule, option C cochlea, and option D tympanic membrane. Organ of Corti. Question number 52. Inner layer of a heart and blood vessel is composed of option A cuboidal epithelium, option B squamous epithelium, option C transitional epithelium, and option D columnar epithelium. Squamous epithelium. Question number 53. How much there is required for the kidney to filter all the blood present in the body? Option A 4 seconds, option B 1 minute, option C 4 minutes, and option D 40 minutes. हाम्रो बडीमा भएको ब्लडलाई फिल्टर गर्नलाई किडनीलाई 4 मिनट लाग्छ. Option C the right answer. Question number 54. During strenuous exercise, which of the following will happen? Option A increase in heat production, option B increase in oxygen demand and heat production, option C increase in oxygen demand, heat production and muscle blood flow, option D increase in oxygen demand, heat production, muscle blood flow and cardiac output. Option D is the right answer. Question number 55. At the mid part of duodenum, there is an opening common to the penetrative duct and the common bile duct. This opening is guided by option A pyloric sphincter, option B cardiac sphincter, option C sphincters of OD, and option D ileocecal valve. Option C the right answer, sphincter of OD. Question number 56. As seen in a posterior anterior radiograph of the thorax, the left margins of the heart shadow include which of the following structure? Option A left auricle and left ventricle, option B pulmonary trunk, option C both A and B, and option D none of the above. Both A and B, left auricle, left ventricle and pulmonary trunk. Question number 57. Which is the correct orders of a process in digestive system? Option A indigestion, propulsion, excretions, absorptions, digestion. Option B indigestion, propulsion, digestion, absorption, excretion. Option C indigestion, propulsion, absorption, digestion and excretion. Option D all of the above. The correct sequence is option B. Indigestion, propulsion, digestion, absorption and excretion. Question number 58. Splenomegaly means option A enlargement of testis, option B enlargement of tonsil, option C enlargement of spleen, and option D inflammation of mouth. Splenomegaly means enlargement of spleen. Option C. Question number 59. Epilepsy is a disorder of option A circulatory system, nervous system, digestive system, urinary system. Nervous system. Question number 60. What must the nurse does to determine a client's pulse pressure? Option A multiply the heart rate by the stroke volume. Option B subtract the diastolic from the systolic reading. Option C determine the mean blood pressure by averaging the two. Option D calculate the differences between the apical and the radial rate. Pulse pressure means subtract the diastolic from the systolic blood pressure. Question number 61. Review seasons with a staff member. Which of the following action is appropriate? Option A tell the staff that the season is a manager centered. Option B the season is a private between the two members. Option C she inform the staff that she may ask another nurse to read the appraisals before the season is over, and option D none. Option B is the right answer. Question number 62. Profession is an occupation based on a certain specialized criteria. Which of the following statement is appropriate for the criteria of a profession? Option A, autonomy. Option B, personal qualities. Option C, both, and option D, none. Autonomy. Question number 63. Total number of International Council of Nurses (ICN). Option A, 135, 120, 86, 78. 135. Question number 64. She come across the theory which states that the leadership style is effective dependent on the situation. Which of the following style best fit a situation when the followers are self-directed, experts, and are mature individuals? Self-directed, sir. Option A, democratic. Option B, authoritarian. Option C, laissez-faire. And option D, bureaucratic. Option C, laissez-faire. Question number 65. What are the qualities that define a leader who uses laissez-faire? Option A, she involves the group in a planning and in decision making. Option B, she oversees everything to come up with a good quality. Option C, she tends to be passive and puts the responsibility of decision making to others. And option D, none of the above. Option C is the right answer. Question number 66. Downward communication is described below. Which one is correct? Option A, the communication is between two supervisors. Option B, the flow of communication is from the head nurse to supervisor. Option C, the flow of communication is from the chief nurse to the head nurse. And option D, the flow of communication is from the staff nurse to the chief nurse. Option C is the right answer. The flow of communication is from the chief nurse to head nurse. Question number 67. A guide that defines the general course of activities to accomplish a desired goal. Option A, policy. Option B, procedure. Option C, rule. And option D, regulation. It is a policy. Question number 68. Program is. Option A, comprehensive plan that include future use of resources in an integrated pattern. Option B, prescribed manners for performing given tasks. Option C, series that make up establish a way of performing work. And option D, general statement which guide a manager. Program is a comprehensive plan that include future use of resources in an integrated pattern. Option A is the right answer. Question number 69. Which of the following is not a basic functions of the management process? Option A, controlling. Option B, leading. Option C, both A and B. And option D, working. Working. Question number 70. The term planning is. Option A, recruiting and selecting a person. Option B, identifying and grouping the work to be performed. Option C, determine how to fulfill the objective. And option D, all of the above. All of the above. Question number 71. Permanent scar is seen after ... vaccine. Option A, BCG. Option B, OPV. And option D, JE. BCG vaccine मा scar आउँछ. BCG vaccine the first vaccine. Question number 72. An organization had invested on the land for the expansions of the complex is an example of. Option A, operating budget. Option B, rollover budget. Option C, operating budget. And option D, capital budget. Capital budget. Question number 73. The formal structures of an organization show in blueprint depicting formal relationship, functions and activities of the salaried employees are called. Option A, policy. Option B, organogram. Option C, record. And option D, all of the above. Organogram. Question number 74. Which is the correct procedures for collecting a sputum specimen for culture and sensitivity testing? Option A, have the patient place the specimen in a container and enclose the container in a plastic bag. Option B. Have the patient expectorate the sputum while the nurse holds the container. Option C. Offer the patient an antiseptic mouthwash just before the expectorates the sputum. Option D. Have the patient expectorate the sputum into a sterile container. Option D is the right answer. Have the patient expectorate the sputum into a sterile container. Question number 75. An autoclave is used to sterilize hospital supply because option A. More article can be sterilized at a time. Option B. Pressurized steam penetrates the supply better. Option C. A lower temperature can be obtained. And option D. Steam causes less damage to the materials. Option D is the right answer. Remaining questions next test ma include garneछु. Thank you so much. All the best to all.